It's a program. We got ourselves an interview in the studio, our friends over at GRMC, and our regular Tuesday feature of the doctors, the other personnel, the staff from GRMC that lend health care and quality health care on Guam. And we reserve this time every Tuesday morning. And today we're going to be speaking with Dr. Shay, not that Dr. Shay, as in Jeff Shay, as in Scott Shay. Good morning to you and welcome to the program. Thank you for joining. You want to talk right into that microphone? Interventional Radiologist. That sounds really intimidating to those of us from the naked eye. What exactly is that?
So it's a minimally invasive surgical procedures dealing with the blood vessels of the brain and spinal cord.
Ah, okay.
So I focus basically on stroke. There's different kinds of stroke. One stroke is where you have a blocked vessel in the brain due to blood clot. There's also hemorrhagic strokes where you have a ruptured brain aneurysm, so I treat brain aneurysms, ruptured and unruptured. I treat acute strokes with blood clots obstructing important vessels going to the brain.
Does a walking person know that is happening to them? Are there any symptoms of this kind of blockage that presents itself?
Yeah, strokes can manifest in many ways, but there's an acronym that I try to explain to people FAST, F-A-S-T. So if there's facial droop, arm weakness, speech changes, then they should seek medical attention as fast as possible.
Okay. And some people are fully aware of that and others aren't.
Right.
Yeah.
Well, most people are aware initially, at least. Unfortunately, many people actually have strokes when they're sleeping. So if you're asleep, you're not going to be aware of it.
What if you're sleeping? You can get a stroke while you're sleeping. How often do you see that happens?
Here, probably about 20% of the cases are wake-up strokes.
Wake-up strokes. So they
occur during sleep.
Wow. And how do you and it's through those symptoms that you know that might have happened to you?
Correct.
Oh, okay. You also have a brother here. Is he also in the same specialty as you are?
Yes, he is. He works at. He doesn't work at GRMC primarily, but he does backfill me whenever I'm off island, so that we have round the year, calendar year.
What are the odds of that? Did your parents raise you both of you are going to be neurointerventional radiologists?
Yeah, just worked out.
Did it work out? Who's older of the two? Are you guys twins or you?
We're twins.
Okay, so
But he's older.
Okay, so he's older, and he went into medicine before you, or you both went in about the same time, or
we went in at the same time.
Wow, so you had a shared interest as you were growing up.
Correct.
Wow, and then you would, we have a couple of forecasters from the National Weather Service that have the same sort of story. And they're both stationed on Guam, and they both look exactly alike. And every time we interview either one of them, it's sort of you don't know which one you're talking to. You guys look exactly alike, or you?
We look similar.
Similar. Okay. Well, talk to me about strokes. I mean, Guam's rate for.
Yeah, we have a lot of vasculopathy on the island, vascular disease patients on the island because of risk factors to include hypertension, diabetes, hypercholesterolemia. So we have a lot of people that are having problems with legs, but also with brains because of blockages of neck or brain blood vessels. We had a case last week where strokes don't always occur in older folks. We had a 31-year-old woman who was 36 weeks pregnant. And it was an unusual case for a variety of reasons, but she actually works at GRMC. She lived just up the hill from GRMC. She started having the classic triad of symptoms strongly suggestive of stroke. The facial droop. The husband noticed also that her speech was slurred and then she became nonverbal. She became progressively weaker on the right side of her body, arm and leg, and then she became paralyzed on the right side. The husband called 911. And she was taken to Memorial, which was actually farther away from where they lived, and they don't treat stroke there. I happen to live close to GMH. The ER doc called me directly from GMH, so I jumped in my car and drove to the hospital. This was around 5:30 at night. And I said, get a CTA, see if there's a blood clot in the brain vessel. By the time I got to the hospital, she was on the CT scan room. I had gone right to the radiology department. I quickly diagnosed that there was a major clot in a major blood vessel on her dominant hemisphere, left side. Instructed the ER to get her transferred immediately to Medical City, and I jumped in my car and drove there as well. We got the clot out, restored flow to the dominant left hemisphere, and what was most remarkable of all was within 5 minutes, while she was still on the angiography table, she started speaking normally and moving her right side.
Wow.
I also had OBGYN in attendance because she was 36 weeks pregnant. They did not have to do anything emergent as far as delivering the baby. The good news is just 3 days ago, she was kept in the hospital for observation. They induced her on Friday. She delivered a healthy baby girl Saturday.
That's amazing. But the services you say are not available everywhere. I mean, you provide the service over at GRMC, but that is the place you go. That is the place you go. Is that what you're saying?
Correct.
Yeah.
Correct. Most cities or townships this size will only have one stroke center. It's not really cost effective to have duplication of services when you're talking about an island this small with a population this size. So you don't want to have it's not cost effective to have two of everything.
Yeah,
so each hospital should focus on what their strengths are.
If you hadn't been there, if there hadn't been somebody in this specialty, what would her prognosis have been?
Well, she would have had a devastating stroke where she would have had a large part of her left hemisphere non-functional. In fact, when it's on the left dominant hemisphere, sometimes it's life-threatening because of swelling. But she would not have been able to speak. She would not have been able to move her right side.
But her chances of survival would have been.
Dominant hemisphere in that location, maybe 50-50.
Yeah.
But again,
too close for comfort.
But she wouldn't have been able to ever speak.
Yeah.
She wouldn't have been able to move her right side.
Yeah.
And that would not have been a good thing.
No, certainly not. Not when you're trying to raise a child. There are a couple of incidences that I have seen, and they have certainly made the news of other, quick action that has been taken by you. And these stories that come through the way they come through are important to understand only because the time is of the essence, correct?
Correct. When it comes to stroke, time is brain. And in this particular instance, the patient was with the husband at a work function, like a party of some sort in the late afternoon. She started feeling weak on the right side. She started having some slurred speech. The husband said, "Should we go to the hospital?" And she said, "Let's just go home. I'm tired." And they went home. And then they called 911 about a half hour later, and then they went to the wrong hospital, and then so it was delay after delay after delay. So I tell people that when they're having symptoms, you've got to immediately go to the, call 911.
Yeah. I mean, is this information that everybody should have, like on the refrigerator door? Is the prevalence of strokes on Guam so high that this is like regular information that you need to know along with other emergency?
Absolutely. And what I've noticed here, maybe it's partly cultural, but the refrain that I've heard repeatedly was, let's just put, the family member, grandfather, whoever, put him on the couch, let him take a nap, and wake up, he'll be better. And that's what this woman did. She wanted to go home and take a nap. And when you're having a stroke, time is of the essence.
And so in that way where she was just fatigued, you could easily pass it off to, hey, you're 38 weeks pregnant. You're always fatigued in the last trimester. She could have chalked it up to that had the symptoms not been noticed by someone else.
Correct.
So,
her husband noticed a facial droop and then the progressive right-sided weakness. So it was alarming to them. But it was a... she definitely dodged a bullet.
No kidding. And you are apparently her guardian angel for that as well. How long have you been on Guam now?
I've been here for 21 months.
Oh, okay. How you liking it?
I like it a lot.
You like it a lot. You like the
I like the lifestyle. I like
Mm.
the weather. I like just the vibe overall.
You're a California boy. You're a California boy.
Yeah,
So the
born in
vibe is important when
Right.
when you're outside of California.
But I'm excited about a hospital that's providing things that this medically underserved region of the world hasn't had previously.
Yeah.
So we've got neurosurgery. Now we have an interventional cardiologist. So we have pediatric ICU, adult ICU. We're kind of we have a variety of subspecialists that are new to this region in the last couple of years, and it's exciting to be a part of a new program.
Does it kind of make a difference to you personally that you're in a region that is underserved as opposed to being in a place with a vibrant hospital and you're driving a Maserati down the street and you have a great specialty but the services are established?
Oh, absolutely. No question. It's a very rewarding experience. And the other thing that I've noticed here, unlike on the continent, the appreciation that the vast majority of patients demonstrate when they receive health care here.
Well, when you're the only guy in town that can save the life of a stroke victim, they're going to put up like a memorial wall for you or something, or at least erect a statue.
But that's a refrain that I'm hearing from all the docs too. So the ER docs, primary docs. The patients here are very appreciative of the health care they receive. Because
unlike other diseases that people are inflicted with, the stroke, you can't get on an airplane and find another hospital someplace else that would do the duty.
Absolutely not.
So. And the other important point to make is if you are having a stroke and you suffer you're showing all of the symptoms, you should detail yourself directly to GRMC, considering you are the only specialist there.
Correct, and we've actually talked to the EMT service, the emergency medical transport, because they should do preferentially.
That's the agreement, right? You go to the closest facility.
Right. Well, no, the closest. Well, in this case, if they're having stroke-like symptoms, they should go even for farther. So if the patient's in the south,
right,
they should bypass the Naval Hospital. They should bypass GMH, and they should go to the stroke center.
Okay. Because there's an actual stroke center. It's called that, and it's within the facility. Yeah.
Correct.
Well, it was really nice meeting you. I'm assuming that somehow or another we'll see you guys around town. I haven't seen you before. You gotta get out of that hospital and get some of that sun in you.
Yeah, and what I want to say real quickly is we have a neurologist, a fellow board-certified neurologist who's part of the stroke team, Justin Hale, and we have a neurosurgeon, Gary Powell, who's also a board-certified neurosurgeon. So it's a team approach.
Okay. Well, fantastic. I really do appreciate this. Dr. Scott Shay, the other one, S-H-A-Y, and his brother Jeff. Maybe you'll see them around town somewhere. This is our weekly presentation, Your Healthcare Partners, brought to you by GRMC, where patients are partners.